Hi, I'm Suzanne, and I'm one of the registered nurses here at Pacific Center for Plastic Surgery. I'm going to talk to you today about general post-operative instructions. We're first going to talk about your activity. When you go home today, you're going to rest, and it's important every couple of hours that you wiggle your toes. You don't need to wake up in the middle of the night and get up and walk around, but we do want you during the daytime hours to get up and move and wiggle your toes and keep that blood circulating. If you have TED hose on, you need to keep those on your feet too for about 14 days after your surgery. Also, it's important to remember that you can't do any heavy lifting or bending. There's no sexual activity for 2 weeks after your procedure, and you also need to not drink alcohol or smoke during the next 2 weeks. Let's talk about your position. We talked a little bit about that in your activity, but you do need to sleep elevated for up to 2 weeks. When we talk about elevation, it needs to be a minimum of 2 pillows high. Like I said, you can use a recliner chair, or you can use a couch, or you can even get those neat pillows that kind of sit behind you. But you do need to sleep elevated, and you are going to need help for the first few days getting in and out of bed and going to the restroom. We've talked about activity and we've talked about positioning. Let's talk about ice packs. You can use 20 minutes on, 20 minutes off to the affected area. Something that's really helpful is to use frozen peas. I suggest that you buy a couple bags of frozen peas, and then you can rotate them through the freezer and just apply it to the area that you have had your surgery. Next, let's talk about wound care. You will have tape on the area that you have had surgery. That tape is going to remain on until your first post-operative appointment. If your tape happens to wear off during that time, then you can just apply brown paper tape that we have in the office and reapply that back to the affected area. During your post-operative time, you're going to be taking pain medication. We don't want you driving while you're taking any pain medication, because this does inhibit your ability to make good decisions. Let's talk about some of the common medications after surgery. First, we have your antibiotic. This antibiotic, if you've had a local anesthetic, you will have already taken your first dose before the procedure. You'll take 1 dose that night and 1 the following morning. If you've had general anesthesia, then you'll start taking your antibiotics when you get home, and you'll take the remainder 2 the following day, in the morning and then in the evening. Next, we'll talk about your pain medication. This could be Norco, it could be Ultram, it could be Celebrex. It's important to take your pain medication as directed by the doctor, especially in the first 24-48 hours. After that, you can take the pain medication as needed. A common side effect to taking pain medication is constipation. That's why on your list of medications, we recommend that you purchase Colace. Colace is a natural stool softener that just helps soften that, because the Norco tends to cause constipation. Also, general anesthesia can kind of slow things down. So it's important, if you already have an issue of constipation, to take Colace on a regular basis so that you have regular bowel movements. Some other medications that could be common would be Famvir. If you have a history of getting herpes either on your mouth or other areas, if you've had shingles, the doctor will usually prescribe for you to take Famvir for about 10 days, usually 2 days before your surgery and then 8 days after surgery. Some other medications could be a clonidine patch, a scopolamine patch, and within those 2 patches, the clonidine is for blood pressure, and that's something that you would leave on for 5 days after your surgery. And another patch, which is a scopolamine, stays on for 3 days after your surgery, and that helps with nausea. When you do take that nausea patch off, please remember to wash your hands after you take that patch, because if you accidentally rub your eyes, you'll have blurry vision for up to 24 hours. Another common medication that we prescribe for you is Zofran. And Zofran is an anti-nausea medication. and that you can take every 12 hours, and that helps with some people have an upset stomach to pain medication, some have an issue with anesthesia, but it does help kind of settle your tummy down. It's also important to eat some crackers or have some toast or something before you take your medications. You may feel a little dizzy and lightheaded, and you also may feel a little itchy. This is all very normal in the healing process. It's also normal to have bruising and swelling, and this can take up to 6 weeks for this to start to go down. If you get a fever 100.4 or above, you need to call the office. Also, which is very uncommon, you can watch for excessive bleeding or swelling. Anytime you have concern, please call the office and our staff will be happy to help you and ease your mind to let you know if there's any problems that you need to be concerned about.